Mbega igitondo gisusurutse, mbega akayaga kiganje iwacu, mbega ukuntu abantu baberewe, buri wese aranezerewe. Agaciro niko mbona buri wese arakihawe.
And was also responsible for student welfare. He was the academic director of vocational studies in the undergraduate curriculum and coordinator of community-based education at Glasgow University. He has served on the Scottish Council of the Royal College of General Practitioners, that's the RCGP, as the international lead, and on UK Council of RCGP, as well as being a member of the International Committee of RCGP. His clinical work was based in one of the most deprived parts of Scotland and included work with victims of torture. His doctoral thesis is on accountability in healthcare, and his master's in education focused on transformative education. He's co-editor of Practical General Practice, which is an evidence-based approach to medicine, and is also the co-author of the handbook of empathy-based communication skills. He founded a trade fair charity and trading company, and is a trustee of two further African development charities. In the UK, he used to cook regularly. He's a good cook, and he used to do that for charity organization. And he's also a Methodist preacher, as Madam Chairperson has mentioned. So I think this is not the first time I have introduced Phil Cotton to you, but shortly I'll be so happy to introduce him to you as the principal of the College of Medicine and Health Sciences, and I think you too are privileged to be having him to lead us in the next journey. So I will start from here, but I would also like to start by myself, if I'm not so selfish. I'm called for John Bosco, and I have been the personal assistant to the rector. I hope I will be helping up here as the executive assistant, if he allows me. Yeah, and let me start from here.
Thank you very much. Shimimana Alexi, the acting director of ICT Center.
I'm Olive Tegera, skills lab coordinator.
I'm Marisha Ndaruimana, acting head of department midwifery.
I'm Mkubwa Dennis, head of student.
I'm the coordinator of community health outreach.
I'm Captain Lieutenant, procurement officer. I'm Sandeep Aswat Safi, acting director for research projects. I'm Yaka Italian, head of department of human nutrition and dietetics.
Charles Rangira, I'm representing head department of pharmacy.
And he used to be the head of department.
Bonaventure Tuyisenge, coordinator, career advisory center.
Frank Gasana, RMA, I'm head of department of health sciences. Thank you.
I'm Noah Osman, is the therapy department. Head of
Mukoma Samuel, head of department of postgraduate
about changing my name. But the team was popular because there's a problem which has the departments of nutrition, about the comments there.
I'm Omega Crispinus. I'm the acting Pakatomara in Health Sciences and also the acting director of department.
My name is Joyce Murenzi. I'm the director academic committee assurance.
My name is James Josephlin. I'm the IT coordinator of Health Systems and coordinator of Masters in Informatics.
My name is Firmar Sabimana. I'm the acting academic registrar and also director of the Language Center.
My name is Emmanuel Ginger. I'm the director of life.
I am Associate Christine, head of department in the program, the professional counseling.
My name is Jean-Marie Vianney, coordinator clinic placement.
My name is Jonas Tugema, Nyamisha Campus Coordinator.
I'm Roman Tade. I'm the head of the Department of Biomedical Lab Sciences. I'm Alex Musime, head of Department of Nursing and currently acting in Faculty of Nursing Sciences.
I am Marie Claire Gasangama, acting head of the nursing department.
I'm Zaibra. I'm David Brown, dentistry.
I'm Captain Juma, Director of Postgraduate Studies.
I'm Moses Siaki, Managing Director, KHI Business Development.
Patrick Maya, head of Department of Medical Sciences.
I'm Amy Bushaija, head of Department of Clinical Medicine and Health.
My name is Iman Thierry, Public Relations and Communication Officer.
I am Shima Natasi, Director of Finance.
February Mukabaye, acting director of Blank.
Much indeed. It's a difficult day, isn't it? It's a difficult day because we're saying goodbye to somebody that we love and has loved us. Thank you very much for what you've just said. You've almost said everything I wanted to say. Thank you very much for your welcome. And I want to thank Dr. Chantal for lots of things. I want to thank her because she's been incredibly generous to me over the last few months. We've known each other for several years, but she's allowed me, permitted me to come into her campus, onto her campus, and walk around and to meet with staff. And on many occasions, not to even have taken the time for the two of us to meet. And I thank you very much for your generosity in that regard. I always get a little annoyed when I hear Dr. Chantal described as an acting rector, because there's nothing that she does that's an act. She is an incredibly generous person. She's an incredibly genuine person. And because she's such a genuine person, I refuse to use the word acting about her at all. She also shows the most tremendous amount of grace that you will have experienced over the years, but I've experienced over the last couple of weeks. She's welcomed me into her office and talked very openly about the handover process and the process of leaving the institution, and indeed of welcoming me into the institution. We're only here because we want to serve, other people. We want to serve the population of this country. And as academics, we want to serve our students. Our students are our most important asset. Our students are our legacy. And in terms of serving one another, we have to make sure that our levels of service in the institution, particularly our levels of service towards our students, are the very best they possibly ever can be. But we also have to remember that very key aspect that was just articulated there, that as leaders, and we're all leaders, that we need to be servant leaders. We need to serve one another. We need to honour one another. We need to respect one another. We also need sometimes to take a lead, and that can be difficult. Thanks very much, Ford, for everything that you have done. Tremendous amount of support to me since I've been here. Thank you very much for promising, I think it was a promise, not to cause me any headaches. I sadly can't make that promise back to any of you. I think some of you may be going home with headaches, and your hairstyle may approach mine much sooner than you ever imagined, for those of you who are gentlemen in the audience. It's an exciting time. As Dr. Chantal has said, we're welcoming other institutions to our family, that is the College of Medicine and Health Sciences. Not only are we taking KHI, which is a fantastic, amazing organisation, as Dr. Chantal has said, we're welcoming the Faculty of Medicine from NUR and all of the component parts of that faculty. We're welcoming the School of Public Health from NUR too, and we're also welcoming, and this is significant for us, we're also welcoming the 5 nursing schools in the country. And so the School of Nursing, as Dr. Chantal said, will be by far the biggest in terms of student numbers and faculty numbers in the entire college. And I can guarantee for you now, it will be the greatest too. Yeah. The School of Nursing deserves to be one of the best schools of nursing in the region and in the continent, and that's what we're going to aim to do. KHI has spawned so many good things, and of course this year we've got the BDS program, the first ever dental school in this country, and the BSc in midwifery, which was created in a time scale that will become legendary. And so I thank you very much for letting me poke my nose and intrude into your business over the last couple of weeks. But my sincere thanks goes to the lady who said it all when she said to me in her office earlier today, you know what, I just love my staff and my students. They're the best. So I consider myself an incredibly lucky human being, an incredibly privileged human being. Thank you very much, Chantal.
Start by telling us, after handing over, what do you think you come up with as a new director of this college?
Yes, and starting with this place, at this place on this campus, of course it's just the beginning of the story, because we're going to be taking the 5 nursing colleges, the Faculty of Medicine from NUR, the School of Public Health from NUR, as well as all of the many faculties that are in KHI. So we've got a real task to create a new family from many different institutions with their own cultures and traditions. But we've got the greatest assets we need, which are the staff, the faculty, and the students. Just incredible, phenomenal people with a major commitment to my vision. It's a shared vision, which is that we only ever exist in this place, in healthcare, to serve the population of this country. And as an academic institution, we only really exist to serve the needs of our students. We want to prepare the best possible students in the world with the best possible skills and knowledge to serve the population of this country at times when people are in greatest need, when they come to us as patients, and also to consider areas such as health promotion and health prevention and better health. And we know that we have to work as a healthcare institution not only to provide good care as soon as you enter hospitals, but to work with other sectors to make sure that nutrition is as good as it possibly can be, that sanitation is as good as it possibly can be. So our work doesn't stop at the bedside, but it goes beyond that. So I think one of the biggest challenges is going to be to make sense of all of the people that we have to involve in the care of people who live in this land.
So we have been hearing different problems from the people who go to health centers and elsewhere seeking for care, and they have the problem of lacking good services in healthcare providers. What do you think you will improve on that, as the one who have in hand the person who should take that service to the people?
No, thank you for asking that. That's vitally important, isn't it? That actually the starting point for what we do is the people that we serve. And so to engage with people, to hear what people's needs are, to hear what their experiences are incredibly important. And all of our students will, in the course of their study, have to connect with real people, with people who are patients, to find out what it is that they need and what it is that is their experience of healthcare. One of the things that we are so fortunate in this place is that we have a Minister of Health and a Minister of Education who are committed to working together to drive us forward in the most coherent and sensible way. And I want to sit and listen to individuals and their experiences of healthcare, and that's what I do as a clinician. And we have the infrastructure, we have processes, we have physical buildings, we have health centres. But actually what really, really makes a difference to the lives of people is the engagement with the human beings that call themselves nurses or doctors or clinical officers or dentists. And what we're going to see is some of the most empathic, skilled, well-trained health professionals that East Africa, that this continent has ever seen.
I've got that you have been working with people. You are a best cook, as I've understood. I thought about your background in healthcare. What is your background that you think will help you going on leading this campus?
My background, my clinical work has been with victims of torture, with people who come to the country that I've just left to seek asylum. And my framework for thinking about medical education is to think of it in terms of an oppressive model, a model of oppression. That actually what we bring to healthcare is empowerment, and realizing what empowerment truly means, it means to remove those things that oppress people. So whether that's judgment or prejudice or discrimination or lack of access to health facilities because people are disabled or they don't have money or they simply cannot find transport to health centres is something that drives me. So to remove those things that oppress people, and some of the things that oppress people is that you come and see me in my surgery and you're scared of me because I'm a doctor, and we have to remove that. Doctors are first and foremost human beings, and any student in the College of Medicine and Health Sciences who doesn't realise that before anything else they are a human being who has to make meaningful connections with other human beings actually probably doesn't have a place in this institution. Yeah?
Seki abanamuteguriye igiseke cy'ababyeyi musezeraho ariko turacyari kumwe.
Murumva naho umuyobozi mukuru rose amusanga hariya akora akazi gasanzwe nk'agasanzwe akora, anyakira kandi anyakira neza cyane. noneho rimwe ndamubaza ndekuru ko wowe ubundi ukora kwirekura nicyo uri gukora kwa visiregiteri. aravuga ngo we ngo yumva ashaka kwicara gusa akajya akorera hariya kwa visiregiteri. ambera umwana mwiza, ambera inshuti, ibyo ni inshuti yanjye pe. hari n'ibyo rwose twashobora kuganira kandi njye ndi umuyobozi we muyobora, wenda ntashobora no kuganira n'abandi. noneho rimwe umuntu aza kumvira aravuga ariko wowe kuri visiregiteri y'umuyobozi mukuru ukora iki na yose?
In fact, as the student, we are grateful to what you have done. As productive leader, the organization was achieved more. For example, the main programs, including departments, was increased. The new program, bachelor's in dental surgery, now was coming. The postgraduate and master's programs, those things are here. I think these are the cornerstone of this institution. It is difficult to say goodbye for a reader who working together in a peaceful manner. But we hope that we still together through your.
Heard there was a secret chord that David played and it pleased the Lord, but you don't really care for music, do you? It goes like this: the fourth, the fifth, the minor fall, the major lift, the baffled king composing hallelujah, hallelujah. Hallelujah, hallelujah, hallelujah.